Hi, my name is Dr. Sarfraz Ali. I'm one of the infectious disease doctors at OakBend Medical Center, here to answer some of your questions about coronavirus.
So, what is it, and what does the name mean, and how does it affect humans?
So, coronavirus has been around for a while. If it's considered a common cold virus, we commonly have it in the hospitals. We treat it on the normal basis as a common cold. Patients do get affected with it. However, this is a new strain of coronavirus that has been picked up from Wuhan, China. If you recall, SARS was one of the coronavirus as well as MERS. Both of them were coronavirus that were started from thought processes from an animal and cross over to a human species. So the name 2019 coronavirus is because it's isolated in 2019.
Okay, so where did it start and how?
So the hypothesis is it started from Wuhan, China, in the meat market, where there is animals of different types. People were in a close confined area where there is different exotic animals, and people in China are purchasing these animals. So it is felt that it has jumped in from an animal to a human species or human contact.
Is it communicable, and if so, how is it spread? Through the air, by touch, saliva?
So it is usually communicable. It's just like the influenza, like the droplet. Patients have a large particle droplets, cough, sneezes, and if you're in a close confined area, you pick up the inhalations, so you are at a risk of acquiring it. At this point in time, I'm not sure touch or kiss or anything like that, but majority of this is through droplet.
Is it fatal? How many people have contracted it, and how many have died?
So as far as of this morning, I believe there's 4,500 cases, and of that, 106 have fatalities around 17 countries. But what is presumed, most of these fatalities are occurring in patients who have comorbid conditions under respiratory illness, elderly patients. Those are the ones that are apparently dying from this illness.
So, you mentioned elderly people. Who does it affect? The young, the old, or all ages?
It could affect all ages. However, we see this common patients who come into the hospital with comorbid conditions, underlying respiratory or cardiac illnesses. They are more prone to getting the worst disease process. So initially, coronavirus, when we see it in states, we see it as an upper respiratory infection. We see the upper lobes involved. It's common fevers, chills. Those are the symptoms. However, patients who have acquired this form of coronavirus, they tend to see a lower respiratory disease. They see much more common bilateral pneumonias, and patients are presenting with worse respiratory distress.
Do we have anything to worry about in Fort Bend County?
You know, the only thing I think you need to worry about is this is an international population in Texas. We have a lot of travelers, so wherever these cases are being isolated in the States, there's been some kind of a travel history to the area of Wuhan, China, or around the close proximity of it. So if you are international travelers and people are coming in, if you have any of these type of symptoms of fevers, chills, cough, shortness of breath, I would not take it lightly. I would go and seek medical attention.
Okay. So, what could I do to prevent getting coronavirus if and or when it gets to our part of the country?
So the most common prevention is standard precautions: washing your hands. If a person is sick, wearing the mask around you or around them so you don't have the droplets sprayed onto you. Those are the standard practices as of right now. If you know of anyone that has traveled in this area and they are coming down with sickness, I would avoid meeting them or coming into a close confined area unless you are protected with a mask.
Right now, is the CDC and the Texas Department of Health tracking the virus and its spread?
Absolutely, because they need to know where each individuals are coming from. There is airports that are just isolated to have these patients or people from China travel to these airports, so they could isolate them, test them out, make sure if they're having the symptoms, quarantine them, put them in an isolation room, and backtrack it to see where they acquired it from. It is at this point in time very well seems to be controlled. The people out of China are giving good information, giving us good informations on who has it, how many people have it, how many people are affected with it. So we are getting good information from them to help us better equip ourselves.
Right. How would I know if Fort Bend County ends up with a case of coronavirus?
I think most of this is publicly recorded, so if anyone, most of the hospitals, if anyone has these kind of patients, they will have to involve the public health department of the state of the Texas, as well as get everyone else involved who are the authorities, and so they could track this and see if this is truly a coronavirus or is there another respiratory illness that the patient has. This is still a very naive and native thing, so majority of the people who are going to come in now we are still worried about influenza because that is the most common thing spread. So people need to be tested, and once you're tested positive, I think then they will go towards the State Department, Health Department.
So, is the CDC and the State Health Department taking steps to prevent the spread of coronavirus? And if so, do you know what they are?
Absolutely. So these are the same steps that I mentioned earlier. So they are tracking these patients, tracking the people who are coming out of Wuhan, China, tracking their whereabouts, and they're making sure that they're following them closely to see if they develop any kind of symptoms or any kind of illness. Most of these guys are being not interrogated, but very quarantined from the airport, saying that, okay, are you having these illnesses, are you having these symptoms, and they're getting tested. So they are being tracked up. We are tracking them from the get-go. So I think they are doing very well at quarantine or isolating the patients who may have this. I would say that if anyone in listening to this, if you have any concerns, definitely you are equipped to go to the hospitals because they're the ones who could probably test the coronavirus the quickest. Most of your urgent cares and most of your private practices are not able to do the test of coronavirus. It is a respiratory panel that they have to order. The turnaround time is there. So if you have concerned symptoms and if you are traveled in this place or came into contact with patients who have been traveled to this place, if you are concerned, if you have the symptoms, I would urge you to go to the hospital and get yourself tested. Thank you.